critical services, police, fire, ambulance, they are all being called on to do much more in the face of the rapid spread of Omicron. There are growing numbers of sick calls and staffers having to isolate as the case numbers go wild, really, John. We've heard it described as being spreading like wildfire. I say John because it's John Northcott who's on that story for us, talking about the threat this is posing to Canada's critical infrastructure.
Yeah, absolutely, Heather. When you consider how closely together emergency services personnel work, whether it's the 3 or 4 crew members on an ambulance, whether it is firefighters sleeping and working communally as they do in a fire hall, you can imagine how something as virulent and as contagious as Omicron could potentially be in those environments. That's what we're seeing in centers right across the country, decisions having to be made. Winnipeg, for example, the chief of police declaring a state of emergency there. This because effectively 9% of the overall staff, now this of course is frontline officers as well as support staff as well, but 9%, still a considerable number of the 1,900 member force there off work in the city of Winnipeg. More on that in a moment, but let's look at Edmonton and the fire crews there where 5% of the workforce is off. Let's listen to the chief as he describes the situation.
Right now, we're looking at what work is priority work right now, whether it's on the front lines or in our fire inspections branch. And we continue to backfill using off-duty staff to make sure that we can meet our service demands. As we look at items like training or other non-emergency activities, we'll reprioritize them as well to absorb any some of the staffing impacts that we'll see.
That reprioritization, or at least planning for reprioritization, is happening right across this country with emergency services, whether it be Montreal, Toronto, Nova Scotia with its emergency services as well, and Prince Rupert, British Columbia. This a community that has, of its fire crews, well, there's only 20 on its fire force, but 13 of them are off because of COVID. Heather?
John, what happens if the situation worsens and those shortages become longer term?
Well, Heather, and when you say that, when you say situation, it could be the Omicron situation with those off, sick, or because they have had close contact and following protocols. But it could also be a natural disaster. It could be a major crime incident. It could be a fire in a residential neighborhood or a fire in an industrial complex involving, for example, evacuations. All of that we've seen in small cities and towns, small and large, right across this country. And presumably it could happen again in the face of what they're dealing with these staff shortages. Morale also an issue as well. Let's listen to one chief talk about that danger.
It's been a tough haul for our people. Morale has been challenging at times. Overall, I've been very pleased with the response of our members and their professionalism throughout this ordeal. They continue to amaze me with their level of discipline and professionalism. This is just one more strain, and we'll do our best to help them get through this. And ensuring that we have resources in the front line will be one of our priorities.
So it is looking at priorities right across this country in terms of providing emergency service. It is also looking at the intangibles, the human aspect of it, the spirit, the camaraderie, the esprit de corps of all of these organizations. And of course, we need hardly remind Canadians, Heather, that this situation has been going on for such a long time. And all of these services and frontline personnel really having to dig deep into their hearts to keep on going, especially when they're looking around and they're not the same members side by side with them in the ranks.
John, thank you very much. That is the national picture, national challenges confronting the provinces and territories. Let us focus in, though, for the next few minutes on Nova Scotia. Dr. Robert Strang is back with us. He's the Chief Medical Officer of Health for the province of Nova Scotia in Halifax this morning. Dr. Strang, thank you for returning to our program today.
You're welcome. Good morning.
Good morning. I know you were listening to John's reporting just there, and I'd like to begin there. How great do you think the risk is to Nova Scotia's critical infrastructure, police, fire, ambulance, water treatment, sewage, as a result of this Omicron wave?
Well, I think for across all sectors, we're having workforce pressures. People who are infected, but even more so, the number of people that are identified as close contacts and having to isolate for a period, and that is one of the factors. Like other provinces, we announced yesterday, coming to effect tomorrow, that people with close contacts who are fully vaccinated, 2 or more doses of vaccine, and don't have symptoms can continue to go to work with strict masking protocols, and then part of the rationale for that is we just need to have all parts of society functioning as best we can, and during this Omicron wave, and it's part of the path to living with COVID. We just have to be able to function more normally, and so we do have to take on more risk, but allowing contacts to go back to work is important.
That was going to be my exact question, if that was part of the thinking in announcing the change in the requirements, which take effect tomorrow morning. And you mentioned them. Just going to bring them up so people can see what Nova Scotia is doing, as other provinces are, reducing the period of isolation required for fully vaccinated people from 10 days to 7. And here's the quote: if there are no symptoms or symptoms are improving and there's been no fever for at least 24 hours. But what I don't see there, Dr. Strang, is there's no negative test requirement at the end of that. Why not?
No. So sorry. That's the criteria for cases. So we have to
cases.
For cases, and we know that once there's 7 days now, we can say that people can be considered to be non-infectious. So we don't need to test them. They will test positive after being a case for weeks, if not several months. So there's no point in testing a case. We know that after that 7-day period, they are low chance of getting infected. I know some other provinces are choosing 5, but when we looked at the data, really it's 7 is the cutoff that we have the low, really low chance of being infectious afterwards. Going to 6 or 5 days increases that risk. The other bigger piece that I just talked about is for close contacts. If they're asymptomatic and have fully vaccinated, they can continue to go to essential activities, which is really go to work, go to school, and function, and monitor their symptoms carefully. Of course, they need to still continue to do their testing as contacts at 72 hours, and if they get symptoms, then they need to isolate fully and then do testing to rule out an infection.
The announcement came yesterday from Ottawa that the federal government is distributing these 140 million new rapid test kits to the provinces and territories on a per capita basis. So Nova Scotia will get its allotment. How do you plan to distribute yours, Dr. Strang?
So that those are already kits that have already been promised. We've already planned for all of those. That wasn't an additional amount of kits than what has already been allocated. So we prioritize our testing for people who are 50 and over, or medical conditions in general. Though they get a PCR test, and for other people who have symptoms, or if they're a close contact, they're the ones that are using rapid test kits now. So we're prioritizing through access points across the province, people, as I said, who fit the criteria for having symptoms or being a close contact, and that's how we're handing out our, allocating the rapid test kits on that basis. We no longer have the luxury to be able to do a lot of asymptomatic testing, just people feeling, wanting to have the comfort of testing negative. We have a finite resource that we have to prioritize.
Dr. Strang, this could be just my inaccuracy here, but I feel like I have to ask. I feel like it was set out yesterday like it was a new announcement from Ottawa for 150 million new kits. Are you suggesting that it wasn't that you already knew you were getting those, or did I misinterpret that announcement yesterday?
Well, my understanding from my team, who have been involved directly with the federal government, is that announcement was kits that have already been allocated, and provinces and territories have already planned for those kits.
Okay. I will we'll definitely be talking about that further. When you look at the science and the research of this, as a province that has made very effective use, the Prime Minister signaled that yesterday, of rapid tests, how effective are rapid tests, Dr. Strang, in detecting Omicron specifically?
They're a very good test, and especially with now we're testing people where there's a high likelihood of there's so much circulation of Omicron. It makes the reliability of a positive rapid kit even more valid. That you can assume that a positive rapid kit is a very good indication that it's a true positive, and so we're no longer going to be doing confirmatory tests with a PCR. We'll just take the rapid kit at face. Test kit result at face value.
So that's with the positive result. There has been some concern expressed about false negatives. Very strong with the Delta variant, but not as good with the Omicron, these rapid kits. And as a result, there's been some discussion about how we should use them. And I'm wondering if you could help us with that. There are some who are suggesting that with Omicron, we should actually be using the rapid test kit and swabbing the back of the throat rather than the nostrils. Or some have suggested either or both together. Do you have any new guidance on that at all?
So I've actually had that came up yesterday, and I've talked with my colleagues at the lab, and they're looking at how they might do some validation of that, that thought of doing swabbing the throat first and then the nose. So that needs to be studied, and we need to look at that. Does that actually provide a more accurate test result? So, like so many things, we need to wait, do some rapid science on that, and my lab folks are looking at the possibility of doing that. I think you're absolutely right, though, that a negative, I think that's one of the risks of the rapid test, that people say, oh, I'm negative, and they can go about business as usual. No, a rapid test kit is only, even if it's negative, is only valid if it is valid for the time being, and people still need to follow all the public health measures and cautions. And that's why for contacts, if they're first at 72 hours, if their first test is negative, we still want them to do another test at 48 hours after that. So we really are relying on having to have two negative rapid tests 48 hours apart before we can say people who are identified as close contacts, we can be assured that they're not positive.
I was struck earlier this week by something that one of your Atlantic Canadian colleagues had to say, Newfoundland and Labrador, that most people will get Omicron. And even Nova Scotia's premier earlier this week saying one should assume when you go into a gathering or a room or anywhere that at least one person there has Omicron, is positive at this point. I mean, do you agree with that assessment, that that is how we should regard the prevalence of Omicron right now? And if so, what do we just do? Do we throw up our hands and assume we're going to get it, or how do we act and react?
No, you're absolutely right that with the high prevalence and the infectivity of this virus means it's quite likely that I use the phrase that if we're out and about, then you have to assume that you might be exposed, and it's quite likely that many of us will get an infection. But that even the vaccine helps blunt that infection. Even 2 doses of vaccine still provide some good protection against severe disease. They're not great against any infection. So we have to shift our focus and not worry so much about the daily case counts and how many people are getting infected. The focus has to be on are we slowing on the rates of severe disease. And so our goal is to use restrictions and public health measures to slow down the spread, not prevent spread, but slow down the spread, so that the number of people at any given time requiring especially hospital services is manageable within the capacity of the healthcare system.
So we watch the hospitalization rates very closely. Flatten the curve. I remember we don't use that very much anymore, but we have to bring that back, I guess. That's what you're suggesting in your last response there, Dr. Strang.
It really is. Spreading this out over the next number of weeks, this wave will end, but we have to slow it down and spread it out so give our acute care system the maximum chance to be within its finite capacity. And this is part of Omicron is moving us probably sooner than we were anticipating, but much more about living with the virus. The majority of people are going to get mild to moderate illness from this, so we have to accept that fact and focus much more on preventing severe illness. It's moving towards more of a way we approach influenza, but right now we still have a lot of challenges, as we just talked about, infrastructure, everything that the next few weeks are going to be challenging all across Canada.
Dr. Strang, I always appreciate time with you. Thank you very much again.
Thanks for the opportunity. Have a good day.